Doreen Granpeesheh is the
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
I want to switch up here, and Lisa has written in and said, if you're still taking questions, and we're trying to, Lisa, we're trying to get through as many of them as we can. I would like any advice on my dilemma. I have 3 grandchildren living with me. God bless you, Lisa. My youngest grandson is 12 and he's on the spectrum. He has come such a long way, being diagnosed at the age of 4 years old. He was nonverbal and a headbanger with several meltdowns daily to now being high functioning in the sense that he is verbal, smart, and is artistic. We've had awesome help along the way with therapists and ABA counseling and community living support workers. But her question is that he struggles with anger management and social interaction behaviors. He struggles in school with his peers and some of his teachers. So she would like some advice.
Yeah, so that's really important. And congratulations, Lisa. So nice to see that he's doing so well. But, you know, social interaction and challenging behavior are very important to deal with, right? So I always, whether it's a child on the spectrum or it's us, we act out, we have challenging behaviors or show anger when we are frustrated, and the frustration comes out in the form of sometimes some behavior that is not appropriate, like challenging behavior, like yelling at others or hitting them or whatever it might be. So
can I just add that Luana has also written in to pair this with, so we have the 12-year-old that's having issues, but there's also a 4-year-old that Luana has who's becoming aggressive because he can't express himself.
yeah.
So if we can talk about.
There you go. Thank you. Yeah. And again, and thanks for saying that, Shannon, because like again, not being able to express yourself, when it's a 4-year-old, it's kind of easier to see because you're like, oh, he gets frustrated because nobody knows what he wants. When it's an older child, it gets mixed up with other things. And then we think, oh, this child has anger management issues. It's not really that. It's just that they've learned that showing you what they want, because they can't otherwise communicate it, showing you what they want with anger is effective. So I'll give a few examples of that. It's kind of like when it's a little child, you know, they try to grab a toy, the other child doesn't let go of the toy, they get angry, they hit the other child, and they get the toy. Okay, so that scenario is, oh wow, that was pretty effective. By hitting, I got what I wanted. Okay, so it's an immediate lesson that hitting works. And that goes on for years and years and in different ways, right? We go to a store, I will tantrum and hit mom unless she gives me the candy that I saw on the aisle and I wanted. And mom, of course, is like, you know, in a public place, embarrassed, and so she will give you the candy, right? And then that becomes a lesson that every time I want the candy, I'll hit. So over the course of time, our kids kind of learn just from circumstantial situations that hitting or being aggressive or showing anger works. Because whenever they're angry, they either get something they want or they get to avoid something. Like, for instance, another scenario is, I'm in school, I don't really want to be in this classroom, I'd rather be outside playing, I throw a tantrum and I throw a chair or whatever, and they take me outside and I get what I want. So a lot of scenarios teach us that anger works. And the reverse of that is just to teach that anger doesn't work, communication works. So the way that you do that is, and it's harder when you have an aggressive, I think it was 12-year-old or, you know, an older child who's bigger. So you might need help from a behavior analyst, but really what we're talking about is making sure that the angry behavior is ineffective. So they can be angry, but they're not going to get what they want. They're not going to get out of the situation by being angry. But instead, if they communicate, which you will help them with, you model the communication, you make it easier. The way that you want them to go has to be easier, right? And you want them to use communication. So it's got to be something very basic, like if it's a nonverbal child, often we'll just use an icon that the child like picks up off the Velcro and gives to you, which is, I need a break, I need a break, or I want that, or, you know, pointing to the picture of something they want, or pointing to the picture of going outside to play, whatever it is, communication. And we make sure they get it. So we make sure it's something that we can give to them at that time. But if they hit or show anger or scream or whatever, it's extinction. So we ignore that, and we don't allow, of course, with anger, you have to be very careful, because, you know, you can't ignore when a child is hitting you. You have to block it, right? And you have to act like nothing is happening, and you go on. So that's why I'm saying whenever there's an extreme level of anger involved, and it's, let's say, 11 or 12-year-old, I do recommend getting professional help, because it gets worse before it gets better. Because think about it from the child's perspective, something they used to do in the past that worked isn't working anymore. So they're just going to increase it a little. So for instance, for the child that's like, leave me alone, and then everybody leaves. Now they're like, leave me alone, and people aren't leaving them alone. They will start to push, they will start to hit, they will just accelerate it, because why isn't it working? And it will be a little bit of time before it actually goes away, because then they'll be like, okay, no matter what I do, I'm not getting my way. But that period of time can be very dangerous, difficult, and most of the time as parents, it's a very emotional time, so we give in. And we're kind of like, oh my God, I can't handle this, I'm just going to give in. Which really makes things worse, because now we've taught the child to communicate using even a higher level of anger. And so you don't want to do that. You really, when you're dealing with things that have to do with challenging behavior, you really need to have a plan, and you need to make sure that you're not going to give in when the child does aggress, but when they communicate, you're going to give them whatever they want. It's hard.
It's very hard. And I just appreciate everything that you said. And you guys know how much I love this woman, and that I love that, you know, most of her conversations start with some form of her saying, listen, it has to be fair. Because I think we forget that in the conversation. I do want to put a little disclaimer, though, because I think a lot of times, Dr. Granpeesheh, parents hear everything that you just said, and it sounds something like this: womp, 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 ignore the behavior,
Right,
or ignore the child.
right.
And I just want to make sure that if you need to, part of the reason why we record these shows and they're available in podcast is you can go back and listen to it over and over and over again. I love the blog, Diary of a Mom, and have followed it since my child was diagnosed. And last week she did a big post, a big rant about, please stop telling parents to ignore the child when they're engaging in challenging behavior. And I read what she said, and she made this great case about, you know, they're trying to communicate,
Yeah,
and you should listen to them. And I was like, okay, I just feel, and I wrote it, and I said, I just feel the need to say that really good quality ABA does not tell you to ignore the child. It tells you when the child, that all behavior is communication, and that the child is communicating something. And the first thing you have to do is figure out what it is they're trying to communicate, teach them a better way to do it, and make sure that they have a way to do it.
yeah.
So I just want to make sure that people understand it is not just ignore the behavior. It is, and it's never ignore the child.
Yeah. So first, there's a big difference that we should make clear about ignoring a behavior and ignoring a child. There's a big difference, right? You can interact with a child while you ignore a behavior. You act like the behavior didn't happen, and you continue interacting. You can also block the child and ignore a behavior. So there's a lot of things that are different, but ignoring a child is, I don't think, ever appropriate. That's just not something you do. So, and then going back to what Shannon was talking about, yeah, if you just ignore a behavior, another behavior will replace it, which might be even worse. So what's more important is to teach. That's why kind of ABA programs there are two sides. You're ignoring behaviors that are challenging, but at the same time, you're teaching behaviors that are adaptive to replace those behaviors. Because you do want to know how your child is communicating. You do want to know what they're trying to communicate. But if you continue to respond to challenging ways of communication, you will be the only person in the world who will do that. As your child gets older, other people, peers, teachers, adults who take care of your child, no one will accept a hit or a scream or a pinch or a push or a shove or anything aggressive as communication. And then your child will be very angry because he's not able to communicate with the world. So if you want, when we want our kids to be able to communicate with the world, we really have to teach them ways that are acceptable in the world. And that means teaching verbal communication, non-vocal communication as well. It doesn't matter, but communication of a normal communicative sense instead of challenging behavior. And that has to happen a step at a time. And as Shannon said, every behavior analyst will begin with what's called a functional behavior assessment, where you identify what is the child trying to communicate. If you don't know that, you can't even set up a behavioral program. You need to know, is my child trying to communicate he wants out of the class? Is my child trying to communicate he wants that object on the shelf? Is my child trying to communicate he's annoyed by the sounds around him? Whatever it might be, you have to figure out what that is through an FBA, which is a procedure. And then you have to teach your child an adaptive way to communicate that.
If you found anything helpful in this video, please give us a like. In fact, make sure that you smash that subscribe button on YouTube and give us a like on Facebook. You can also follow us on Twitter and Instagram for important updates. And please download our free podcast wherever you get your podcasts. See you next time. Until then, give your kiddos a hug from me and one for you too. Bye-bye for now.
To subscribe, click here. And if you'd like to check out some more of our videos, click here.